Good morning. My name is John Hodges. I'm a student physical therapist assistant.
Hello, my name is Jonathan Hutchinson, student physical therapist assistant as well.
So today we are working on our mock treatment. We had case study number 4. Our patient's name is Joseph Tribbiani. He likes to be called Joey. Joey is a dentist. He lives at home with his wife and 2 kids. He is 4 weeks post-surgery for a left medial meniscus repair. The surgery was secondary to an injury that he sustained while skiing about 8 weeks ago. And the medial meniscus is a C-shaped piece of cartilage in the knee joint that acts as a shock absorber and helps to stabilize the knee joint. So being that they were able to do just a general meniscus repair, that means that it was only the outer third of the meniscus that was damaged. The outer third of the meniscus is vascularized, so therefore a lot of times it's able to repair itself without a more invasive surgery. So currently he is unable to squat past 20 degrees of knee flexion. His weight bearing is tolerated. He's using auxiliary crutches, and he's wearing an adjustable knee brace that allows up to 90 degrees of knee flexion and 0 degrees of extension. He is unable to currently ascend or descend stairs. He has complete joint effusion around his left knee. That's a grade of a 3+. He scored a 16 out of 80 on the lower extremity functional scale, which indicates complete activity limitation. The patient has decreased range of motion and left knee flexion, as well as terminal knee extension without the brace. The patient also has weakness in the left knee extensors, the quads, and has a past medical history of asthma with use of a bronchodilator inhaler, but otherwise the patient is fit and active and in good health. Some of the precautions for this guy. So he wants to be braced in extension for 2 to 4 weeks. Also, you just want to gradually progress the weight-bearing exercises. Also want to be aware of the clicking sensation with exercises. If this happens, then it is a good idea to contact the surgeon. So a couple of the short-term goals that we have for Mr. Joey. We want him to be able to ascend and descend 10 stairs that are 4 inches high. And we also want to increase his passive range of motion and a knee flexion to 135 degrees. Our PT's plan of care will help to improve strength deficits by prescribing exercises to increase quad strength and improve functional mobility. I'm also going to implement manual therapy techniques to increase their passive range of motion. Good morning.
Hello.
How are you doing today?
Good, how are you?
Doing well. My name is John Hodges. I'm a student physical therapist assistant. Could you verify your name and date of birth for me, please?
Yeah, Joey Tribbiani, March 19th, 1984.
Okay, great. That's what I have as well. So I understand you just had a left medial meniscus repair.
Yes, sir.
Great. How is that feeling today?
It's about a 2 out of 10 right now.
2 out of 10. Okay, yeah, I'll take it. Have you been instructed in your weight-bearing precautions as well as the use of auxiliary crutches?
Yeah, they just told me for my foot that as much as I can tolerate, if you want to explain that deeper, and then also for the crutches, they just said to just not put my armpits on the actual handles.
Yeah. So with the crutches, so you want to kind of make sure that you're pushing into the handles and kind of taking some, when you're walking, to make sure that you're taking some of the pressure off of your armpit area. Because if you put too much pressure on it from the auxiliary crutches, it can damage the auxiliary nerve. So you don't want to do that.
Cool.
And then as far as weight bearing is tolerated, so that literally means that you can just bear as much weight on that leg as tolerable. You
Cool.
Still want to be careful not to overdo it though.
Yeah.
Does that make sense?
Yes.
Okay,
Thank you.
great. Just a few questions before we get started. So, do you have any active infection?
No.
No. Any open wounds?
No.
Any inflammation?
No.
Any freeze or fracture? Any issues with hypermobility?
No.
Any pain with active movement? And any severe cardiopulmonary disease such as congestive heart failure?
No.
Okay, great, cool. Well, we can proceed. So today, what we're going to be doing is we're going to be doing some exercises. I'm going to be doing some range of motion measurements on your lower limbs, on your legs, as well as doing some manual muscle testing.
Okay.
Is all that okay?
Yeah, that's perfect.
Okay, great. So to get started, we're going to be doing some manual muscle testing of your quadriceps muscle. So first, on your right side, I want you to go ahead and straighten out your leg as much as you can. Very good. Now, can you do the same thing on your left side? Alright, alright. There you back down. Now, can you go ahead and just come about halfway through that movement on the right? Very good. Now I'm gonna push your foot down. Don't let me push it down. Hold, hold, hold. Very good. And then now same thing on this side. Just come up about halfway through that range of motion. Very good. Now I'm gonna push your foot down. Don't let me do it. Hold, hold, hold. Okay, very good. So on your right side, you got a score of a 5 out of 5, which is normal. On your left side, you got a 3+ out of 5, which means that you were able to withstand minimal resistance. Okay. Does that make sense? Yeah. So next, I'm going to be measuring the girth of your right above your knee. Is that okay? Mm-hmm. Okay, good. So the purpose of this is basically I'm just checking the amount of fluid that you have in that knee, and then I can compare the measurements and see the difference in how much girth there is. Great. All right, could you come to lie on your back for me?
Oh, thank you.
Have you been having any trouble at home with
Not really.
Okay, okay, good. All right, so I just need to feel for making sure black line. I'll go just a couple inches above.
Mm-hmm.
Good, I got 57 centimeters. All right, now we're gonna do the same thing on this side. Just gotta find those same landmarks. Alright, so I got 59 on this side. So it has gone down a centimeter since your initial visit. Do you have any questions for me about this?
No, I do not.
Alright, great. For this next part, I'm going to be measuring the range of motion of your knee going into flexion into extension. Is that okay?
Mm-hmm.
Alright, so I'm going to place this towel under your heel. Is that comfortable?
Yes, sir.
Alright, that's going to palpate some landmarks. So I'm just going to apply a little over pressure. Is that okay?
Mm-hmm.
Go ahead and lift the leg. Apply a little more pressure, okay?
Mm-hmm.
So I got 0 degrees of extension and 130 degrees of flexion. So your left side now. So I'm gonna apply a little under pressure. Is that okay?
Mm-hmm.
Alright, I got about 90 degrees. I got 0 degrees of extension and 90 degrees of knee flexion on this side. 150 degrees is normal range of motion for knee flexion, so you were a bit below. Do you have any questions for me?
No, not at all.
I'll be doing what is called passive range of motion. So what I'm going to be doing is I'm going to pick up your leg and I'm going to bend you into knee flexion. It was similar to the movement that we did when I was measuring your range of motion. Is that okay?
Cool. Yeah.
Cool. Like relax. Does this feel okay?
Mm-hmm.
Alright, now we're going to do this 5 times. Alright, so now we're going to do passive range of motion on this side. Feel okay?
Mm-hmm. Oh, yeah.
Right there.
Yeah.
Is it okay if I try to push you just a little further?
Teeny bit. Oh, yeah.
I'm going to do that 4 more times. Doing okay, Joey?
Mm-hmm.
Good job, you guys. One more time. Alright, we're all finished up with that. So the purpose of this is me doing that, taking to the passive range of motion, should overall increase your range of motion so that you can take yourself further into that motion.
Cool. Awesome.
Do you have any questions for me?
No, I do not. Thank you.
Alright, are you not ready to stand up and get moving?
Mm-hmm.
Alright, good. Yeah, we're gonna be doing some exercises next. So, what I want you to do is I'm gonna have you swing the legs off and kind of push yourself up to the seat. Nice, very good, very good. So this here is a gait belt. This is for your safety and mine. Do you have any incisions or anything around your abdominal region that this could aggravate?
No, sir.
Okay, cool. So I'm gonna put this around your waist and I'm gonna hold on to this while we're upright and moving. It's for your safety and mine. Is that okay?
Yeah, that's perfect.
Great. Alright, now go ahead, step the crutches out forward, very good. And then go ahead and just stand relaxed with your arms hanging. Very good. You can go ahead and grab the crutches again.
Mm-hmm.
Alright. Now, go ahead, we're going to kind of turn towards your right. You okay?
Mm-hmm.
Alright, now reach over to the table with your right hand. There you go, raise up similar. Alright. I'm just gonna make sure that your toes are pointed forward, feet are about hips width distance apart. Perfect, perfect. Go ahead, stand up as straight as you can. Alright, now these are called terminal knee extensions. So what I'm gonna have you do is just go ahead and just straighten out this knee as much as you can. There, good. Now go ahead and let go. Do that again. It's time to hold it for about 3 seconds. As slow as you can. Alright, we're gonna do that 5 times. Alright, very good. That was 3 sets of 5. Now I want you to go ahead and do the same thing on your right leg. Alright, that was 3 sets of 5. Very good. So the purpose of this is to number one, it strengthens your quadriceps muscle. It also helps with you achieving that end range knee extension when you're upright moving. Does that make sense?
Mm-hmm.
Do you have any questions for me?
No, sir.
Alright, so now we're gonna move on to another exercise, okay?
Alright.
So we're gonna be moving on to mini squats. So you've done some squats before in your life, so you'd be coming all the way down to about 90 degrees. What I want you to do is only do a mini one. So what we're gonna do is come back down to about only 45 degrees of your knees being bent, and then we'll come right back up, okay? So I really want you to focus on core, so really just holding and bring your belly button into your spine, and then keeping that back nice and tall, and just come straight down to about 45 degrees, and then come right back up, okay? So we're gonna actually have these crutches just right in front of you, so if you want to just hand me those crutches real quick. I'm just gonna do those right there. Alright, so I want to see you go ahead and do those. So nice job, feet wide apart, and you go ahead and come down about 45 degrees. Nice. You can come down just a little bit more. We're gonna do this about 3 sets of 5. Nice job. It's kind of like you're about to like sit down on a chair, okay? Nice job. 2 more. Nice. 1 more. Nice shot. That was about 3 sets of 5. Do you have any questions about that?
No, I do not.
Do you have any pain right now?
About the same as it was before.
Alright, cool. So, just like I said before, what we were just doing is just getting you to get back to some of that strength that you have. So just building upon that. Does that make sense?
Yes.
Alright. Alright, so now we're going to do some stir training. So what's going to happen is, I know one of your short-term goals was to go up and down 10 steps at home, and you have about 4-inch steps, right?
Yes.
Nice. Alright, so these are also 4 inches, so we're going to be signifying that today. And we're going to do about 10. So we're going to do it 2 times, so you'll get a lot of practice with that. Sound like a plan?
Good.
Cool, awesome. So one of the things we do is that we usually have a memo going up with the good, coming down with the bad. So in this case, what we're going to do is reverse that. We're going to go up with the bad, come down with the good. The reason why is because we want to see if you're even able to clear those 4-inch steps at home. Okay, and you have 2 railings. So what I'll have you do is I'll have you come up with your left, and then you push through your hands and bend as much weight as you really can on your left side. Still utilize the rails and your right foot to take a lot of that pressure off of your left knee, and then you'll bring your right foot up. So then you'll take your left foot up, push through the rails, and bring your right foot up. Left, push through the rails, come over your down. Does that make sense?
Yep.
And you'll come and turn around, and then you'll go down with the good. So you're gonna come down with your good. You're gonna bend that left knee, and then you're gonna bring your left foot to your right. So then you'll lower yourself down, bend that left knee, come here, and then you'll bend that left knee again, and come down. And then we'll have a sit. Okay?
Cool.
Cool. Awesome. Alright, so go ahead and scoot on over. Alright, and on count of 3, what I want you to do is go ahead and stand and grab both those rails, okay? Alright, ready? 1, 2, 3, stand. Let's go ahead and grab that rail right there. Nice. How's your opinion level right now?
Well, feels kind of good to be standing up, actually.
Nice, nice. Alright, so like we talked about, we're going to take that first step with that left, so bring that left up. Yep. Nice shot cleaning that first step. Make sure it's all the way on there. So scoot, yep, nice job. And then bring your right foot to your left. Nice job. So go through that left, nice job. Push through those railings. Nice job, Billy. Nice. Alright, now we're gonna go ahead and turn around. How you feeling?
Okay.
Nice. Alright. So what I want you to do now is come down with that right foot, bend that left knee. Nice. Nice job. One more time. Alright, and then go ahead and turn. And then go ahead and have a sit. Nice. How you feeling?
Good, good. It felt good to be like that.
Yeah, nice, nice. So nice job today. Do you have any questions about what we just did? Alright, just to make sure that we understand it, you were just doing right there, you were just practicing what is going to simulate at home. So I know, like I said before, you're going up and down those steps and the forward steps as well. So we're just trying to help you clear that so that you can just be more functional.
Okay.
Cool. If you have any other questions, let's go ahead and do the last thing.
Alright.
Here's your home exercise program. I promised that I'd give that to you, so I want you to do this while you're at home. Like I said again, this is to help you do some of the stuff that we did today, incorporate that also at home.
Okay.
So some of the exercises that I'm gonna have you do is, some heel slides, quad sets, and short arm quads, okay?
Okay.
So let's go over those a little bit real quick. So for heel slides, go ahead and lay on your back. Bring out your feet. Yep. So for this one, for the heel slides, what I want you to do is imagine, and it's easier when your shoe is off, but what is easier about it is that what I want you to do is bend your left knee and bring it to your butt, but only at the 90 degrees that you're able to tolerate. Okay? So it's just continuously doing that, so bringing that heel to your butt and bringing it right back out. Does that make sense?
Yep.
Cool. The other one that I wanted to show you since you're right here is gonna be a short arm quad. So what I'm gonna do is, can you lift up your right leg and left leg a little bit? Great. So what I want you to do is now straighten out your left leg for this one. So go ahead and bring it up and really feel that tense in that quad, okay? Come back down, go back up. Nice, how does that feel for you?
Good.
Great. And then the purpose for that is just to get some of the range of motion back as well and build some strength on that. Okay, I'm gonna slide this out to you real quick. All right, and then what I'm also gonna have you do is some quad sets. So what I want you to do is come up to sit. You can just do long sets or just straighten out your legs.
Okay.
And then what I want you to do is pretend like you're pushing your knee into the ground. Yep, so you should be having some kind of quad activation right here. So go ahead and do that again. Nice, that's great. Do you have any questions about that?
Nope.
And then I'm also gonna need this back real quick, sorry. I wish that you can have this as well, but I'm gonna need that back.
Oh man.
And so, basically, do you have any questions about anything we did today?
No, I do not.
All right, so just like I said today, a lot of the stuff we just did was just to build some strength and get some of that range of motion and MMT stuff going, just so we can assess where you are and how far you're along. So that way we can get you back to doing whatever you want. Do you have any questions about that?
No, I do not.
All right, man, well, if you have no other questions, you have a wonderful day.